This meeting is being recorded.
As you probably just heard, this meeting is being recorded for educational purposes, and we will be posting it on various social media outlets, as well as sending it out to our attendees for those of you who may wish to watch it at another time. We are offering this talk in Spanish today, and I'm going to ask our student Flor, who will be translating, to share that phone line and that information now.
Buenas tardes. Si necesita asistencia en español, estaremos en una llamada en línea donde traduciré todo lo que dicen los hablantes en la videollamada. Las instrucciones son llamar al teléfono que aparece en el chat e ingresar ese código que está abajo de eso. Gracias.
Thank you so much, Flor. As Flor mentioned, the instructions are in the chat, and she's now going to transition to the Spanish line to assist with translation for our callers there. We wanted to share some logistics with the participants today. If you have questions, please feel free to put them in the Q&A box at the bottom of your screen. Our students, Cheyenne and Brittany, will be helping with question management and making sure that we answer any of your questions. We're also going to ask that if our speakers share phone numbers or websites, that you share them slowly so that we can be sure to put them in the chat and share them with everybody while we're live today and on this call. With that, I also wanted to just add that if you didn't RSVP, so if you're joining us because you saw the link on Twitter or Facebook, feel free to share your email address with us either privately on the chat or in the comments, so that we can keep a record of that and share any resources necessary via email afterwards. I think that covers all of our logistics. And again, we want to thank you so much for being here. I'd like to lastly just introduce a couple of folks that you may see on your screen. We have Ruby Tucker. She's our program representative from the UCLA Pritzker Center joining us today. We also have our students Cheyenne Cobb and Brittany Hun joining us as well, and Flor Ramirez, our other student. Sorry, Flor, you just popped back, joining us today. So those are the faces that you see on the screen in addition to our speakers. We're all here to help and support you as you participate in this conversation today. So feel free to chat with any one of us as needed. All right, I'm going to turn to our speakers now. Thank you both for being here. Let's go ahead and start. If you could please briefly introduce yourself and share your background with our audience.
Roberta, do you want to go first?
Actually, Laura, you can go first.
Okay. So good afternoon, everybody. My name is Laura Alonji. I also have another last name, Brinderson. That always gets left out because it's so long, but just in case, because there are several Lauras in our department to differentiate. Anyway, I'm part of the field faculty in the UCLA Department of Social Welfare in the Luskin School of Public Affairs. And what my role there is, beyond working with students in their internships, is teaching some classes. And also, really the biggest role that I have is to coordinate a program called CalSWIC, Public Child Welfare. And what that means is we have a training program for students who are getting their master's in social work degree and are eventually interested in working for places like the LA County Department of Children and Family Services, or really any public child welfare agency in the greater state of California. So this is Title IV federal funding that comes down to the states to help states train social workers that will then go and work with families in public child welfare, child protective service agencies. So that's my biggest role, and in doing that, part of my role is to train these students in understanding the unique needs of families who become involved in the child protective service system, and both from sort of a policy level as well as from more of a micro clinical lens, understanding how to support these families. So that's what I do.
Thank you so much, Laura. Roberta?
And hello, everybody. My name is Roberta Medina. I'm the Deputy Director from the Department of Children and Family Services. The bureau I have is called the Bureau of Specialized Response Services, which top line our after emergency response command post that goes out on child abuse investigations after hours, weekends, and the evenings. We also have a section called the transitional shelter care facilities, where we have children who are awaiting placement. Prior to their placement, they'll stay with us for a few days, and then we'll be transitioning them out into placement. We'll be moving at periodically see the hotline number, as well as when we end, because what we're trying to do is to make sure that we get out information as much as possible to the public to let you know that we are still working, we are essential workers, and the hotline is always available 24/7.
Great. Thank you so much, Roberta. Roberta, just a heads up, you're cutting in and out just a little bit.
Okay.
So maybe if you can, I don't know, put your antenna up to the sky or something, we'd love to be able to hear you better.
Okay.
On that note, Roberta, can you please give us a little bit of background on the hotline,
Mhm.
relevant data, and how the hotline calls have changed since orders to stay home have been implemented?
Okay.
And then
Again,
maybe,
the Child Abuse Hotline is responsible for responding to all of Los Angeles County's inquiries regarding suspected abuse of children or youth throughout Los Angeles County. We often take many calls. Many of the calls come from the community. In addition to the community, we have mandated reporters, such as teachers, counselors, law enforcement officers, as well as healthcare workers, child care workers, and others that call on a routine, regular basis. If you have connected, they often have the opportunity to see some of those kids during the time that they are working with. The time of the pandemic is that many of those agencies are either working remotely and do not see the children on a regular basis, or you have what we closure. As a result of those changes, we've seen have come into our hotline. So initially, around the same last year, you would see anywhere from 1,000 calls, 50% reduction. Now we're only seeing about 400 calls.
Sorry, you kind of cut out there, starting right after when you said agencies were working remotely and what the impact that had. It kind of cut out for a second. If you could go back
Okay.
to that. Thank you.
Yes, I can go back to that. As I indicated, that now that agencies are working remotely, we have seen a reduction in the number of referrals that are coming into our hotline. And those referrals from calling to our hotline have went from 1,000 to half that. So we are not seeing the same amount of responses that we do on a basis. This is very atypical for services. This is the first time in my 34-year career that I've seen the reduction to this extent and to this level. And it does indicate that many of those children who are staying at home are not available providers that normally see them. I just request, there was a request for billing number.
Roberta, we're going to have to ask you to pause. You've cut out probably every other word, and it's making it really hard to understand, particularly because of what you're sharing with respect to the number.
Okay.
So I'm actually going to stop your video and just see if we can hear you via the audio to see if that might help with the connection, okay?
Okay.
So stand by. All right, Roberta, can you go ahead and start speaking again?
Okay, can you hear me now, or are you still having the cutout? It may be helpful if I call in.
That's much better. Why don't we try this? And if you can maybe back up a little bit, we started losing you in particular when you started sharing the numbers.
Okay. Okay, so again, the question was, what have we seen differently since the pandemic has occurred? In 2019, the Child Abuse Hotline received over 77,000 calls. That relates to anywhere from 800 calls per day. That is what we experienced last year. This year, since the pandemic has occurred, we've seen a reduction in the number of calls coming in, and I'm still getting a indication that the audio still is not sufficient.
Yes, perhaps we might have to have you call in.
Okay. If you can put on chat and put the number call in, I will.
Roberta, this is Taylor. I'll go ahead and email you.
Okay.
Line. Okay. So, Laura, while Roberta dials back in, wondering if you could share any reactions that you might have to some of the information that she was able to share, particularly around the decline in calls and sort of what that suggests to the community.
Yeah, sure. So I think what Roberta was saying that cut out a little bit, and I know Director Cagle, the director of the department, has shared this as well, is that there's been a significant, about a 50% drop in calls, which, you know, translates to on any given day, you might get between 800 and 1,000 calls. And so, you know, that's down significantly, about 50%. And I think the concern there, from what I understand from DCFS, is that not that in fact child abuse has actually stopped happening, but that unfortunately children, because they're home and are not out in the community, are not being seen by anybody other than their families. And so families may still be experiencing challenges, and child abuse and neglect may still be happening. But I think the biggest mandated reporters out in the community tend to be teachers, coaches, after school program directors, and children aren't going to any of those things right now. They're home. And so it would make sense that, you know, calls would drop, because really the people who call in are the folks who we know to be what we call mandated reporters. They basically are mandated to report in when there's a suspicion of child abuse or neglect. And so that's really the biggest concern, is that there's a suspicion or idea that this is probably still happening, but unfortunately children are not being seen by anyone other than their immediate family members right now.
Mm-hmm. Okay. Yeah, it sounds like DCFS has a really legitimate concern that it normally relies on these mandated reporters to, you know, be in touch with them, to be communicating to them about children that could potentially be experiencing abuse and neglect. I'm wondering if, off the top of your head, you have any ideas that we could, as a community, be thinking of to support folks with respect to calling if they suspect child abuse or neglect.
Yeah, actually, Taylor, thanks for asking that. I think it's important, first of all, to sort of clarify that anyone can make a report, right? You don't have to be a mandated reporter to call in suspected child abuse or neglect to the hotline. So it can be anybody. It could be a neighbor. It could be, you know, a postal worker who comes to the house and deposits mail and hears something or sees something. So the main thing is, look for signs of distress. If you see that a family seems to be in trouble, if you hear yelling, if you hear, you know, signs of distress, anyone can call in. And you can do it in an anonymous way, right? You don't have to say your name. You don't have to say who you are, so that if there is a concern, you can just make the report and let it go there. So there shouldn't be a concern about, oh, I don't want to get involved, because if you just you make the report, you do it anonymously, and then the department takes over from there. So I think that's an important thing to let everyone know. Look for signs of distress, and then also be a person that people can reach out to, right? Small acts of kindness go a long way. So if you're a neighbor and you see a family in distress, leaving some toilet paper by their front door, or some coloring books and crayons, or just offering to listen. You know, if you're a neighbor over a fence and you hear something is happening, you can just sort of, you know, raise your hand and say, hey, how you doing? Do you need to talk today, right? So what we're asking, I think, is for community members to become more involved, without having a fear of retribution, because If you engage in a small act of kindness, more likely than not, it's going to be welcome. And if you have a concern, you can report it anonymously and have the department take over from there.
Great. Thank you so much for that background. I think it's really helpful because, you know, we start to hear like, oh, these numbers are down. And then it's like, well, our entire structure for addressing that is out the window. We can no longer say like, well, teachers start calling, or doctors start calling, or therapists start, because the children just aren't seeing these folks. And so we appreciate those ideas. And I think as we proceed with this call, we'll work in some more suggestions and solutions, and also invite our 213 participants who are smart and connected, wise people to leave their suggestions in the chat. We welcome those ideas and would be happy to hear from you on ways that you think this can be addressed, okay? With that being said, I think, Roberta, have you reconnected?
Yes, I have. Can you hear me now? Oh, there it is.
Right now, make sure that you are muted on whatever tool you are using to be that you were using for the video. We've muted you on our end.
That has been muted.
Okay. And we can now hear you. Really appreciate your troubleshooting. And if you don't mind rehashing some of the numbers, that would be super helpful. Thank you.
Okay, not a problem. Now, I think this is going to be a better way for everybody to hear me, so I just wanted to repeat myself. I do apologize for having to repeat myself. In 2019, our child abuse hotline received over 277,000 calls. On an average given day during March and April of this time last year, we may have received as much as 800 to 1,000 calls per day. What we are experiencing in the hotline is very unprecedented. The number of calls coming in is anywhere from 380 to 400 a day. But what we need to make sure that everybody knows is that this is not something that we have seen previously. Can you hear me?
Yes.
Okay. So this is not something that we have seen previously, and we know that we're seeing similar patterns across the state of California and in our neighboring counties. Much like the flow of traffic, when education institutions are not in session, there's a higher flow of calls coming into the hotline. We have peak seasons and we have light seasons throughout the year. People seem to be more compassionate during the Thanksgiving and holidays, and calls reduce during that time, but never to this significant rate. We do anticipate that the influx of calls from the public places, once they reopen and families and children become more visible, that we will see an increase in these referrals. But in the interim, what we want to make sure that everybody is aware of is that there are opportunities for you to continue to be able to make those calls. If you see something, say something. There's additional information that is also available to each of you that you may have heard in some of the press conferences that are occurring on a regular basis. And we are trying to get out as much information as we can in daily notices through the LA County Department Supervisor's Office, as well as other areas. And we are trying our best to be able to get out information to everyone that our offices are still open, our hotline is still available 24/7, and we are there to respond to any referrals that come into our hotline.
Thank you so much, Roberta. Can you speak to how this might differ from hotlines in other jurisdictions, or be a similar circumstance such that all child abuse hotlines are perhaps experiencing this kind of decline in calls?
Yes, we've actually connected with some of our neighboring counties, Orange County as well as San Bernardino, and they are seeing similar declines in the number of calls that they are getting too. Again, most of our directors have gone to social media. We are on Facebook, and we have different platforms on Twitter where we're trying to get out as much information. My director has also been recently on Channel 7 News as well as Channel 11 to be able to make sure that we are providing information to the public on how best to reach us, to make sure that if you have a suspicion of child abuse or neglect, that you are making sure that you call the child abuse hotline and that we're able to respond to inquiries and calls. We're also there to be able to help families connect to other resources that may be available in the community at this time to provide for them.
Okay. And Roberta, this is an add-on to that question. Understandably, families are often frightened by encounters with DCFS or confused about encounters with DCFS. And so to the extent that maybe they're afraid to call your hotline, would it be appropriate for them to reach out to 211 for assistance instead?
Yes, they can always reach out to 211 to call for assistance. 211 will respond to them by looking at the geographic area where they are and giving them agencies that are currently open. As you all know, many of our agencies are working remotely but are available for services. DPSS as well as DCFS have modified the way in which we provide services, but we are all available to families that are in need.
Great, thank you so much. Just again, going back to the data, and Laura, I'd love your thoughts on this also. You know, we all are hoping for the day when the world reopens, when children go back to school, when our retail shops can operate again, when people can get back to work. And I'm wondering what we might be anticipating around an influx in calls, an influx in need of services, and how we should expect to be able to respond to families at that time.
So I guess I can go first and answer that. I think, you know, the one thing to know is that there is, I think, a general expectation that when things do reopen, that there may be a spike in reports. Again, because as Roberta was saying, when children go back to school, when they go back to sports teams, when they go back to the doctor's office, things are going to maybe be noticed. And so there is likely to be an increase in the number of calls that come into the department and an increase in the needs of families. I think, you know, what the underlying issues are that we're seeing now is families being isolated, which is always stressful, right? Especially with young children, and parents not having enough resources and supports to be able to do the job that they need to do. So I think because of that, I think we're very fortunate here in California that our governor has already kind of addressed that. And in terms of funding has really pushed through. I want to say about $42 million of additional funding for children and families in the child welfare system that is designed to be allocated across the board from the prevention end to the intervention end, front to back. And so those monies are going to be allocated then for additional services to what we already have. So I think we're fortunate at the state level. We're also fortunate that we have a Representative Karen Bass in the House of Representatives who also initiated a letter. It's a bipartisan letter with two other representatives, another Democrat and a Republican, that's being put forth as a request for additional money in the CARES Act, specifically to be earmarked for child welfare funds. So we're fortunate and we're looking forward to those funds so that we can have some flexibility in the kinds of services we'll be able to provide on the other side when this is all over.
Yeah, thank you so much, Laura, for mentioning those broader efforts on the part of our elected officials. For the attendees, I just posted a link to the information about the $42 million package that Governor Newsom put forward earlier this week, in case anybody is interested in reading more about that. And Roberta, I'm wondering any comments or feedback on what we can think about for the future?
So at this point in time, we want to make sure that everybody is aware that we also have services that we've put into for family preservation, both prevention and aftercare services. All of our agencies are still available to provide services to families. And what we want to make sure is that everybody is reaching out. This is a time of crisis, and unfortunately, we want to make sure that as families are trying to deal with each of these issues, that they have the opportunity to know that services are out there to be able to assist them. We on DCFS have put on our website additional resources available for families, foster parents, children to be able to reach out. The Department of Mental Health Services also has an active access line that is available. And in addition, we want to make sure that each of the families is aware that you can always reach out to your local faith-based agencies to be able to look for resources as well. Families are resilient and so are our children. But when they're not in the face of the public and they're behind closed doors, we don't always see what's going on. And we want to make sure that neighbors and friends and anybody that interacts with those individuals, if you have concerns, please, again, address those concerns with us and we can try to help as much as we can.
Great. Thank you so much, Roberta. I want to acknowledge that some of our attendees are putting program suggestions in the chat, particularly Parents in Partnership was just mentioned with a one-line phone number. So we'll be sure to share that as follow-up for anyone participating who may like to have that information. And we welcome, again, our attendees to continue to share their suggestions. They're greatly appreciated. We also want to acknowledge that we have participants joining us right now from across the country. So some of you may be hearing this LA County information and thinking, well, how does that relate to what I'm doing in Michigan or Hawaii or Canada, for example? And so we welcome suggestions that you have from your community that we could learn from here in LA. And we also welcome you to take the programs that are mentioned from that are in LA and think about how you might adapt them or implement them in your communities. We really want to thank you all for this national conversation that's happening, but also acknowledge that our speakers are here from LA and many of their suggestions are going to be LA based. So turning back to our questions, we're all aware of some of the disproportionate impact that we see on families of color in the foster care system, particularly African American and Latinx children and families. And I wonder if we can talk a little bit about the idea that maybe the fact that we're not getting so many calls could either be a good thing, or it could mean that children are just at home and they're doing fine. Or it might actually mean that more abuse is happening. And wondering for your feedback on those questions.
Laura?
Sure. So yeah, I mean, I think going back a little bit to what I was saying, I think in times of crisis and in times of stress, we can anticipate that everyone's resources are going to be kind of at the limit, and that parents that might otherwise be already in many ways maxed out because they're working and they have young children at home and they're maybe holding down 1, 2, 3 jobs at this point in time, may be additionally stressed because maybe they can't work, or maybe their children are not going to school and they're not receiving the meals that they would normally receive, and that puts additional stress on a family if they're not getting breakfast and lunch at school, and the family has to then provide additional meals during the day, which is costly. So I think the thought is that there's likely to be additional stressors on families, and that those stressors don't have to translate into child abuse or neglect, but could. And that's the risk. So I think that's what we worry about, is because we normally would be providing, as Roberta was saying, even prevention services to families before they even come into the child protective system. right now those services may not be being provided. And so families might be under greater stressors, and greater stressors can sometimes lead to behaviors that are less than ideal or helpful for families.
Yeah. Thank you for putting it in those terms, Laura. Perfectly said. Roberta, anything that you want to add on that?
Yes, I wanted to add that we're seeing an abundance of additional available information on Facebook and many of the available media sections that are giving tips on how families can deal with stress, not only including activities that you can do with your child while you're at home, how to be able to address the child's fears themselves, how to be able to talk to them. So there's a lot of techniques that are available. Our family preservation agencies within Los Angeles County are posting some information within their websites to be able to make sure that parents can get access to that information. Their role and our role is also to help educate families about successful parenting skills and different techniques. So Children's Institute of LA is an excellent resource. They work extremely closely with fathers and giving supports for fathers. So that's another recommendation that I would make for some. They have very interesting information about their websites that you might want to look at as well. And we're really encouraging everybody to take this opportunity to be able to connect with your family members, connect with external family members, cousins, neighbors, different people that you may not engage with on a regular basis when you're at work or you're at school. We're asking everybody to take the time to make the connection with somebody else. Just go outside and wave at your neighbor, and to be able to make sure that you are looking at all of those different opportunities to engage with your child in a more productive and creative way.
Great, thank you. I also want to mention Children's Bureau put their information in the chat with respect to a home visiting program that is currently accepting new clients. And you can see again their information in the chat. Thank you to the person for sharing it. And we also have LAUSD reminding us of grab and go meals. So please see the chat for that information. Many of us can acknowledge that domestic violence often fuels our foster care system. And so can we speak to that a little bit and how domestic violence might impact our kids during this time?
Yeah, so I mean, I can tell you that oftentimes children are, even if they're not being harmed themselves physically, that oftentimes there's harm in witnessing violence between caregivers, partners, parents, right? And we can also make some guess that domestic violence is also increased during this time. Again, you know, people being home with their partners can be stressful, especially again, if economics are being impacted, if one partner or both are not working. So I think there's a concern that domestic violence is also increasing. And because folks who are experiencing the domestic violence, individuals who are experiencing the domestic violence aren't able to, at this point, leave their homes, that they may be really under additional stress. So there's kind of a double impact with domestic violence, right? There's the victim, possibly the adult victim that might be being impacted, and then of course, children being exposed to this violence might also need additional services later on. The trauma that incurs from witnessing this type of violence is also pretty harmful.
Roberta?
So what we have been experiencing in the Department of Children and Family Services most recently is we work closely with the Los Angeles Sheriff's Department, and you may have recently heard you may have heard recently Sheriff Alex Villanueva speaking about their experience recently, that they are seeing an increase in the number of domestic violence incident reports that they are receiving. Now, we don't usually see that high percentage of calls coming into our hotline unless there is a child involved. So whether or not the child is exposed to that violence or, for example, may be involved in that violence and injured during that incident. But we are noticing that even in the reduced number of calls that we're receiving at the hotline, that we are seeing an increase in the extent of domestic violence. For all of us, as we engage with families in areas of domestic violence, we make sure that we are connecting them back to providers in the area to ensure that they are safe, as well as that their children are safe during this period in time. And we, again, are recommending that our constituency and some of our families and some of those of you on behalf of our families reach out to the Department of Mental Health and their access hotline. There are counselors that are available to talk to you to be able to make sure that if you need any additional assistance, they can help you as well. That is sometimes it's easier to call a mental health hotline or a hotline somewhere else to be able to get some visibility.
Great. Thank you, Roberta. So turning now to some suggestions. Again, I really want to thank our very responsive attendees. Everyone has been sharing great tips. Looks like DMH just added the DMH access hotline, so that is there for participants to view in response to what Roberta was just saying, so thank you for doing that. But what can the public really do during this time? And I think we've touched on things like, you know, if you see something, say something. But beyond those ideas, you know, how can we either virtually assist families or rely on other touch points such as our schools to be supportive to our families at this time?
So in the community, Taylor, there's, and I know I see the panelists are providing us with great suggestions, and I know that they'll all be listed. A couple of things I wanted to highlight just on the national level. Boys Town, it's boystown.org, and they also have a hotline. They have a regular hotline where parents can actually call in just to get support. It's not a reporting hotline, it's a parent support hotline. The number is actually 1-800-448-3000. And if you go to their website, that number is also listed. This is a national organization based out of Nebraska. They've been around for years. And so if you're a community member and you're not sure that you want to spend the time and you know that there's a parent next door or, you know, around the corner that's experiencing difficulties, you could also say, you know, maybe you want to reach out to somebody just to vent, just to get support, just to get some ideas. So Boys Town is one resource that has that. There's also the National Parent Helpline, or operated by Parents Anonymous. And I'm not sure if someone put it up on the chat, but Parents Anonymous has a hotline support line as well, not for reporting, for support purposes. It's not currently 24 hour, 7-day-a-week hotline. I think it's Monday through Wednesday around 10 a.m. to 7 p.m. However, I noticed that Governor Newsom put additional funding specifically earmarked for this organization to increase their hotline services. So they may be providing even more services now. So these two organizations are just two places where if you don't feel comfortable having the parent kind of share with you what's going on, you could say these are two places you can call really for support. And the reason I say this is because I think just alleviating some stress on a parent's end to say it's so hard right now. You know, you're trying to do X, Y, Z and your children are running around the house and you feel maxed out. Just to have a place where a parent can call and say, I can't, it's crazy today. You know, I haven't showered, it's 3 o'clock in the afternoon, my kids are jumping on the bed, you know, things like that. But to have a place to be able to talk about those things is helpful. So those two hotlines I think are helpful. I also wanted to highlight, and of course they're UCLA resources, but they're not specific to UCLA members. The UCLA Mindful Awareness Research Center, also known as MARC, M-A-R-C, offers right now, it's an app, or you can go on their website. They offer free guided meditations, weekly podcasts. So, you know, for anybody who's just feeling like I need 5 minutes to myself to just breathe, you can do that. There's also the UCLA Arts and Healing program, which is offering what they're calling a HOPE series, which stands for Healing Online for People Everywhere. And they have a number of offerings, from doing art with your children, from doing yoga. So there are things that parents can avail themselves of, or they can engage in with their children. It really just takes a cell phone even, and you can connect and take part in those classes, or even just good old PBS. I know that, I use it a lot in my teaching even. So pbs.org is offering lots of support services right now through their programs. There's Sesame Street in the communities is offering some really nice little bits on anxiety, what to do when you're stressed out, trying to talk to your children about COVID-19. And then some of the other programs on PBS that are child focused also are offering opportunities. So I think that's, sometimes we say, oh, you don't want to just put your child in front of a TV. But in times like this, we say, do what you need to get through, right? So if it helps to put your child in front of Sesame Street and have that child just get a little bit of education and also give you a little bit of space, then that's completely fine. I think the other thing I wanted to say, and I want to make sure that Roberta talks to this as well, but some of the things that, I think are very basic tips, again, for people in the community, if you're talking to a family member, even by phone, and you're hearing that they're stressed out, I want to just sort of highlight a few things that as a child focused clinician, I think is helpful. And I tell parents that I work with all the time, the first and foremost, I think, thing right now is just let go of the things that were so important to you before, right? These are not normal times. So, first of all, catch your children being good. If they're doing something for 5 minutes that's quiet and helpful to you, that's the time to say, hey, great job. You're doing something so great and I'm so impressed with you. Because what that does is it encourages a child to continue that behavior. Also, to the extent that you can, when a child is, kind of dysregulated and upset, depending on what's happening, if they're not harming themselves and they need to be running around the living room to get some energy out, as long, again, as they're not harming themselves, maybe you just let that happen for a few minutes. Also engaging them in just easy constructive activities. If they're little kids, you can take like stackable cups and just have them stack them in and out and engage them in that for 2 to 3 minutes at a time. Just even calling a timeout for everybody in the house. If you feel that the anxiety or the stress or the tension is getting to everybody, you can make a game of it, right? And say, we're calling a 5-minute timeout for everybody. Let's all go to different corners of the apartment or the house and do something just by ourselves, whether it's deep breathing, closing your eyes for a few minutes, imagining a nice place. So activities that are soothing for everybody and can help the family kind of get away from each other a little bit. Calling a timeout is always helpful. And then, just give them whatever attention you can. And that's going to look different for every family. But when you have 20 minutes in between an activity, or even 5 minutes in between, a phone call that you're making or cooking dinner, if you want to sit down with a child on the floor at their eye level and just engage them in simple play, depending on their age, I think that's really helpful, because I think it does a number of things. It brings families together. It decreases the anxiety and the stress. And it says to the children, these are not normal times, and we all understand that, and it's okay. We're not going to engage in the same way we used to before this happened.
Yeah. Laura, thank you so much. Those were all like such helpful, practical, relatable tips that I think so many families and so many providers will appreciate. You mentioned Boys Town, and then there was a second organization that you mentioned. Would you mind repeating the name of the second organization?
Sure. It's the National Parent Helpline, and it's operated by Parents Anonymous. And I can give you that number. It's 1-855-427-2736. But it's currently not staffed 24 hours, 7 days a week. It's only offered Monday through Friday from about 10 a.m. to 7 p.m. And the governor is hoping to increase services through that organization by adding funding, but that hasn't happened yet.
Right.
Great, Laura, thank you so much. Roberta, anything to add?
Yes, actually, I wanted to make sure that everybody doesn't forget their older youth. We have a lot of youth out there that are between the ages of 16 to 21 that are aging out of the foster care system or out of the probation system, and we want to make sure that everybody is aware of an excellent resource, iFoster. iFoster has been working with the Department of Children and Family Services to make sure that our youth have the opportunity that other youth outside of the child welfare system have to be able to access cell phones. We want to make sure that that information is available to everybody because we want these youth to be able to have the same opportunities that everybody has. We want them to be able to have those phones not only to entertain themselves, but to be able to also include the opportunity for them to reach out to other students, as well as to be able to access all of the wonderful programs that are now available through the LA County Department of Libraries, as well as the LA Unified School District, in order for them to continue their education and to be able to continue their tutoring. So it's something that we are advocating on the part of the Department of Children's Services. We still have staff that are out there checking on our children to make sure that they have what they need during this time, because it's a very different time for these youth. They're used to being out there, you know, going out to eat, going to different places, engaging with other youth, and having the opportunity to not do that, to be able to be restricted to home, is very different for them. So we are encouraging everybody to reach out to those older youth. They may not be the small and cute ones, but those are the ones that really need us the most. So to the extent that anybody has a friend or a neighbor that has an older youth, reach out to them. Start talking to them about your job, what you do. Get them interested in different and new careers as we're going along, and they can start thinking about what they want to do when this is all over.
Great, Roberta, thank you. There was a couple questions about iFoster, and I just want to refer any questions about eligibility for iFoster's program to iFoster directly.
Yes.
We can put their website in the chat so you can reach out to them to learn what programs and resources they may offer. And then I also just want to reiterate the resources of the LA County Library as well as city libraries continue to be robust and available for free for many, many folks. Thank you so much for those suggestions. And again, thank you to our panelists and attendees for including so many helpful tips in the chat. So we have about 10 minutes left, and I would love to hear any recommendations that our speakers might have around policy suggestions, funding recommendations, resource needs, and how you see a university perhaps being supportive during this time to our families and in the aftermath of COVID-19.
So I think, you know, one thing that we're realizing at the university level is that, again, once things sort of go back to whatever normal that's going to be, I think we're realizing that the timing is right for us to come up with additional programs that support children and families, and as Roberta was saying, transitioning age youth at all levels, right? So right now, as Roberta mentioned, we also have some young people who are on the cusp of basically leaving child protection because they're turning into young adults. And there's a lot of things that haven't happened for these young people that might have happened for them in other times or during different situations. And so I think targeting those particular youth will be really important, as they're going to have just the normal everyday needs of a transitioning age youth into adulthood, but also possibly lack of resources that might still be in the community, maybe fewer jobs available, you know, fewer opportunities for education. So I think that's something we're really looking at as a group of people that we want to be particularly sensitive to, and maybe tailor some programs to that. You know, I think Roberta mentioned maybe mentoring programs. You know, youth need a mentor, somebody that they can sort of look to as a model and somebody who's done something that they're interested in. So, you know, increasing the opportunity for mentoring programs for youth in that age group would be really useful. I think, you know, there's been a huge push in the early childhood arena around understanding that 0 to 3, 0 to 5 age group is so important. And so I think thinking about additional programs to support parents with very young children to increase that attachment, the bonding process. I know there's lots of great programs out there that do this. There's 0 to 3, that's a great organization, but there's many that really focus on that particular age group. I feel like, you know, at the university level, this is something that we need to continue to support and think about programs that that address those specific needs, because again, it's a critical time in development, and helping a child get through those early years really kind of ensures success later on. So those are 2 age groups that I think will be important for us to pay attention to and look at as things kind of settle in.
Thank you so much, Laura. Roberta?
So again, series like this, I cannot thank you enough to UCLA and the Pritzker Foundation for putting on this series of various topics to be able to help individuals during this time. But we also want you to remember our families that are at high risk, that are also in need, that may not have access to the devices to be able to look at Facebook or to be able to look at these media. So we want everybody, and I'm looking to the UCLA Alumni Association and all of the university alumni associations, take the opportunity, walk around, talk about what you do, walk around and talk about information that may be available. I recently received information from the health department. I have friends that are teachers. I have friends that work for the fire department. I have friends that work all over. And on Facebook, we have been working together to share information as it becomes available. We, of course, make sure that it's consistent with the CDC guidelines and providing health information to everybody to be able to get an idea of how to reach out to other people in the community on an ongoing basis. But we know a lot of people are very concerned and very fearful about any type of illness that they might have. So one of the things I did want to share with you today is that we have been working very closely with Health Services Department. The Department of Children and Family Services works with the county hospitals to make sure that all of our children get a medical assessment prior to their placement. But what the LAC-USC hospital has done is established a COVID warm line. And the doctors and nurses are available to answer any questions. And so that phone number I want to share with individuals. It's a line that we share with our social workers, and we want to make sure that we're sharing this with all of the partners that are available on the phone today. That number is 323-409-3090. We know a lot of people are concerned about health conditions, even when they just get a cold. You may want to call that line just to be able to consult without having to go directly to the hospital where you may be at risk. But the doctors and nurses at LAC-USC and the Violence Intervention Program have been instrumental in their support of all of our families in the area. And many of the hospitals around, that they're county hospitals, are also providing similar services. So we want to encourage everybody to, again, to be able to share that information with your neighbors and your friends, because people may not be aware that our agencies are all working together as a county to ensure that all of our services are available to all of the residents of Los Angeles County.
Thank you so much, Roberta, for highlighting the VIP hotline. We put that information in the chat, and just to reiterate, that information is for, it's a phone line that caregivers, foster parents, parents can just call and say, you know, my child has this cough, my child keeps complaining about their knee hurting, things like that. You know, what recommendations do you have? Should I bring the child in? Should I try to treat it at home? And that can be a really helpful resource for parents, particularly parents and caregivers, excuse me, particularly when they feel like maybe going into a medical clinic isn't advisable at this time. We have been continuing to post resources in the chat. We'll compile all of them in a more organized manner and share them with our participants who joined us today, in addition to a recording. We also wanted to just mention that we share all of our resources live on Twitter, and if you would like to look there, they're available at UCLA Pritzker on Twitter as well. Wanted to take the last couple of minutes to acknowledge that, again, these are trying times for our kids, for our families, for our social workers, for our teachers, for our therapists, for anybody working on the ground, passing out meals, doing the testing. All of it is so challenging, and it can feel like a really dark time. Yet I feel, after hearing this call and seeing all these resources, hopeful that if we all just continue to put our minds and our hearts and our hands together, that we can and will come out of this better. And so I'm wondering, Laura and Roberta, if you can close us out with any other thoughts that you might have and ideas on maybe what gives you hope this time as we hopefully navigate the future together.
Sure. I'll say, you know, from the university standpoint, I'm so hopeful because I'm seeing a good number of students being interested in coming in specifically to work in child welfare. We're currently looking at our incoming class because we do interviews to provide these stipends for our students, right? And we have a good number of students already interested in applying. And probably, I don't know numbers right off the top of my head, but I know it's higher than it was last year at this time. So that makes me hopeful, because I think what that says is students coming in to our MSW program to be trained as social workers are really specifically thinking about child welfare. And I don't know if this recent health crisis has had anything to do with it, but it makes me hopeful to know that we have young, energetic, you know, enthusiastic students coming into the field wanting to work with children and families in need. So that makes me incredibly hopeful.
Thank you so much, Laura. We really appreciate you and all the instruction that you provide to our students so that they can go out into the world and do that great work. Roberta, any closing thoughts?
Yes, I wanted just to share what gives me hope at this time. Individuals such as yourself, again, I can't thank you enough for the opportunity to be on this series and to be able to share my resources and thoughts with everybody. I really appreciate Laura's information because she's been really great, and I'm excited to see those social workers come to our department. We are more than willing to provide mentorship with them and to let them know about the new way of business. And when we're looking at the different ways that we do business now, we have social workers teleworking, we have our hotline staff even teleworking, we have different ways that we are doing business, and we know in the future we're going to look at all of these new technologies to be able to do the work that we do to help families. But I also really am hopeful, and I'm really excited about all of the first responders and essential workers who have dedicated their careers to helping others, who continue to come to work day in and day out, and they are making a difference in the lives of families. I think our children and our youth can look to them and say, how can I help? What can I deliver? How can I help you sort information that needs to get out there? How can I help get with you so that I can be one of those delivery people? It's one of the best ways to start engaging with other individuals. And again, to be able to look at all of those essential workers that are out there, the postal workers, people that are working in the restaurants, we are thankful and appreciative to all of them, because with all of them, we would not be able to do the job that we do every day by coming to work every day. But again, I thank everybody for your time and your patience and everything that you do on behalf of the children and families of Los Angeles County.
Thank you both. Thank you. That concludes the educational portion of our call. I'll close us with a few remaining logistics. First of all, of course, thanking our incredible speakers. Let's give them a virtual round of applause for all that they shared and offered to us today. We really appreciate everything that you offered. And I also want to thank our attendees for robustly sharing so many resources. This is the third call of our series, and I have to say the resources here have been through the roof. And so we'll compile those on a one-pager to share with everybody just in case you didn't pick it up in the chat. And we also wanted to remind our participants that the speaker series continues next week on Tuesday and Thursday. You can find information about it on our Twitter at UCLA Pritzker. We will also continue to circulate the flyer. But one of the questions that came up quite a bit today was around families with open DCFS cases and how they will be assisted and supported and transitioned during this time. Our talk on April 21st will actually be with Children's Law Center, and we'll talk about some of the legal issues that are coming up for the children and their cases. And then we also have a talk on, I believe it is April 28th with the Los Angeles dependency lawyers outlining parental rights and a lot of the issues that are coming up with parents and their cases during this time. So a little bit of a shift from this type of discussion, which was of course focused more on prevention and resources, and then moving into some of the legal issues on those later calls. So if those were issues that you were concerned about today, please join us for those discussions. And on that note, I want to just mention and acknowledge our Tyrone Howard, our director. He's here as well. Thank you, Tyrone. And again, close us out. Thank you so much to Roberta and Laura. You were excellent. We appreciate you. And we look forward to sharing all of the resources with this group via email as a follow-up. And yes, we will be recording the talk today and going forward. They'll all be shared with everybody everywhere. Find us on Twitter, Facebook, email us. We're here to help. Thank you all.